Well, Cuyahoga County Executive Armond Budish, thank you so much for joining us. You have been in constant communication with our healthcare systems about the coronavirus for months. And today, for the first time, you say they're worried.
Absolutely. And for good reason. The virus is exploding throughout the county and the state and the country. We have a great hospital system. We have great healthcare providers here in Cuyahoga County. And to be honest, they have a lot of capacity. So up until this point, every time I've called, every time I've talked to them, I've always felt good when I hang up the phone. Today was different. Today they're nervous. I got the impression that they're worried. And it's not because they don't have enough beds. And it wasn't because they don't have enough equipment. It was because they're worried about the personnel. And that is very concerning. The problem is, if their personnel, who have been working, 24/7, day in, day out for months, if some of them get coronavirus, if some of them are even exposed to someone with coronavirus and they have to quarantine, that's going to reduce their numbers of people available to serve the public, and they're worried about that. That's a real problem right now.
We saw our health systems sending people as reinforcements to places like New York City earlier this year to help back up the healthcare workers in those areas. At the moment, it seems like the spread is so rampant, there may not be reinforcements to come here.
You're right. And, we have three major health systems here, all of which are excellent and all of which are typically competitors. But they're working together on this for the very reasons you're pointing out. People have to work together right now. People have to come together, and our healthcare systems are doing that.
You talked about wearing your mask correctly, washing it, keeping that 6-foot distance we all know about. These are things we've heard about for months. Why aren't people doing it?
People are tired. That's the problem. People are tired. I mean, I'm tired. You're tired. We've been doing this for almost 9 months now. And it's easy to get lax. So, people know they're supposed to wear a mask. They don't always do it. And when people do wear a mask, how many times you see somebody walking around with the mask under their nose? That's not wearing a mask. That's not helpful. So, unfortunately, people are just not as vigilant as they were when we started. And we need to get back to that again. We need to wear masks. We need to social distance. We need to wash our hands. We need to sanitize. We need to do all the things that we know we should be doing. Knowing is not doing. We have to do it.
You say we have to take control of the virus before it is too late. When is it too late? And what are you and the county government going to do before we get there?
Well, we're doing what we did today, and what we're continuing to do for the last months is communicate to people, explain to people, tell people about the dangers. I have great faith in the people of this county. I believe that if they really understand what's at risk here, if they don't think, well, it's past, this is over. If people understand what we're facing, people will take action. People will do the right thing. People will do the social distancing and wear the masks and other things. But what we're doing is trying to get that word out. We've got people from the hospitals talking about it now. You look on the television, including on KYC, you see ads from Jim Tressel and Urban Meyer and others trying to explain to people, this is what you got to do. If people take that seriously and don't take it lightly, we can get past this.
What if people don't? What if they don't take it seriously? You said the other option to stop the spread here is a shutdown. If the state doesn't order a shutdown, what would it take for the county to order a shutdown?
Probably a change in the Constitution, because, we don't have that kind of same powers. But I don't think anybody wants to order. Even if we could order a shutdown, we don't want to order a shutdown. It's a balancing. If you can get this fixed, if you can get this at least leveled out without a shutdown, you're much better off. Shutdown hurts people. Shutdown hurts the economy. Shutdown hurts small businesses. Shutdown hurts the employees for those small businesses. And that's another real downside of this virus. So we can't you got to weigh it. You got to balance it. And right now, I think we can get past this without a shutdown if we all come together and do the right thing.
You saw Mayor Lori Lightfoot did this in Chicago, issuing a stay-at-home order for the city there for 30 days starting Monday. Is that something you would try to work with the state or Mayor Jackson or something to advocate for the same if things do continue to, if the situation continues to look so dire here?
Well, I certainly supported the governor in his earlier effort to stay at home. When he issued the stay-at-home order, I supported that. And if the governor determines it's necessary to do it again, I'll probably support that too. But the governor doesn't want to shut down. I know that. I've spoken to the governor. That's the last thing he wants to do, except have people die. That's the very last thing. So we've got to stop this spread now. If we can do that, we don't have to worry about shutdowns. We don't want to do that. Nobody wants to do it. And there's a terrible price to pay if we do shut down.
Are there certain metrics you think that at the county level or at the state level our politicians are looking for before they would take further action?
Well, right now it's, do we have the capacity to help people in the healthcare institutions? And right now, today, we do. But with the projections that I've seen, another week or two, like we've had this past week, we may not have the capacity to care for the people that need to be cared for. So the real metric is, can we continue to care for people that need help? And if we get to a point where we can't, we'll have to look at other things.
And of course, a week or two from now, 2 weeks from yesterday, is Thanksgiving. You talked about that as well. What are you suggesting for people out there, and how will you be spending this Thanksgiving?
Thanksgiving is a real risk. We love Thanksgiving. Everybody loves Thanksgiving. It's one holiday everybody can get into, and it's a family time. So, you bring your family together typically, normally, under normal circumstances. But this year, that's dangerous. If you and your spouse or your partner that's living with you want to have Thanksgiving together, great, and do it at home. But when you start bringing in the nephews, nieces, cousins, uncles, aunts, others, you're creating a terrible risk to your family. And if you bring in friends, they're at risk too. This year, make an exception. Bring them in by Zoom, bring them in by Teams, whatever you use on your computer, and send them a turkey leg in the mail. But don't expand your circle for Thanksgiving if you can possibly avoid it.
And you will not be doing that? You'll just be staying home?
We'll be staying home.
All right. County Executive Armond Budish, thank you so much for talking to us tonight.
Thank you. Appreciate your interest and your willingness to, because this is all about getting the message out. Thank you.
Any final thoughts that I didn't ask you about?
No, I think you did pretty good.
Great. Well, I really do appreciate it. Everybody here was so moved by the news conference today earlier as well. I think the tone, the nature of where we're at right now, you could really tell just hearing from you on this issue. And I hope people are listening.
I sure hope so. It's scary right now. And, when it was really, when I had my most recent conversation with one of the leaders, and I've had now conversations with several, it was a completely different tone than I've had before. Completely different. They're really concerned, and that threw me for a loop.
Yeah, I'm definitely picking up on that for sure.